So when a woman comes to us to discuss egg freezing, there are two big questions that we need to discuss with the woman. The first question is how many eggs to freeze, and the second one is when to freeze. How many eggs to freeze? Why do we have to ask this question? Obviously, it is because an egg does not equal to a baby. So in order to answer this question, we have to know the probability of having a baby for each egg frozen. Unfortunately, data concerning in this area is still very limited at the moment. Nevertheless, there are few papers published trying to address this question. The first one was published in the year 2016 by Doyle et al. In the USA Center. And in this paper, they reviewed the data in their own center. Over a period of around 6 years, only about slightly over 100 women returned to use their frozen eggs. So they had warmed 1,200 eggs during this period of time. And based on the IVF, subsequent IVF outcome, they calculated the chance of having a live birth for each frozen embryo, for each frozen eggs. And we can see that if the woman had her eggs frozen when she was young, under the age of 30, the chance of her having a baby out of each egg is slightly over 7%, not a very high figure. But this probability actually dropped to 5% if she had her eggs frozen when she was over the age of 38. So these numbers are derived from a relatively small number of eggs. So the author then went on to study the respective number in their IVF patients. And of course, this time the denominator was much bigger. So the number of eggs that they looked at was more than 200,000. So from this big database, they again calculated the probability of having a live birth for each fresh eggs used. For women under the age of 30, the chance of her having a baby was around 8%. And this percentage gradually decreased to only 1% if she is over the age of 43. Based on the IVF patients' data, the authors had drawn up these 4 graphs, separating women into different age groups. And for each graph, you can see the probability of a woman of having 1 baby, 2 babies, or 3 babies if she has a certain number of eggs frozen. For example, if she is between the age of 30 to 34, if she had 20 eggs frozen, the probability of her having 1 child in the future is around 80%. But this chance dropped to 40% if she has the same number of eggs frozen, but she is already between the age of 40 to 42 when she has her eggs frozen. In the same year, another group of authors did a very similar review on patients of their own center. Again, the data is derived from around 1,000 oocytes warmed during this period of time. But this time, they only divided the patients into 2 groups, those under the age of 35 and those over the age of 36. But it was shown clearly once again that for women who were younger at the time when they froze their eggs, they have a higher probability of having a baby in the future. A year later, a group of investigators from Harvard Medical School published another interesting paper. And this time, they used a mathematical formula. And they also have formed a number of assumptions. Using these assumptions and the formula, they have come up with this chart showing the probability of women in different age, starting from the age of 35 through to the age of 44, the probability of them having at least 1 baby if they have a certain number of oocytes frozen. And from this mathematical formula, they have developed an interesting internet tool. So if you can input the age of the woman and the number of eggs she has frozen, the tool will instantly give you the number, 3 numbers, the probability of her having 1 baby, 2 babies, or 3 babies in the future. If you change the woman's age from 35 to 36, you can see that the number slightly dropped. And if you change her age to 40, the number significantly drops. Interestingly, in another center, an IVF center in the USA has developed a very similar interactive website tool. This time they base on the calculation on 2 studies, the study by Cobo et al. And Doyle et al. Published in 2016, the ones that I have mentioned earlier. So the way to use this calculator is just the same. You enter the woman's age and the number of eggs she has frozen. And the calculator will give you a probability of this woman having 1 child and or 2 more children with the number of eggs frozen. If you change the age of a woman to 36, the chance slightly reduced. If you change the age to 40, you see a dramatic reduction. But when we compare the 2 calculators, you can see that a different calculator will give you a very different probability. For women at the age of 35 with 20 eggs, this one gives you a 90% chance of her having a baby. And this one only gives you a 74 to 78%. The same for women aged 40. And this was just to illustrate to you the difficulty of accurately estimating the chance of a woman having a baby for a given number of eggs she has frozen. Why is it difficult? Because all these data are retrospective and they have not been prospectively validated. And when it comes to the probability of having a live birth, there are so many factors that can affect the outcome. And these factors may vary even among women of similar ages. These factors include the age at the time of freezing, the medical condition of women at the time of freezing and thawing, and also are there any factors that can affect the implantation rate? For example, the condition of the uterus, the condition of the pelvis, and the condition of the fallopian tubes. At the end of the day, there's no number of frozen eggs that can absolutely guarantee having a baby in the future. And in order to increase a woman's chance of having a baby, she may have to consider freezing more eggs in more than 1 cycle. The second question for us to ask is when to freeze. Of course, if we freeze the eggs at an earlier age, we are freezing good quality eggs, and the woman can actually produce more eggs for each cycle. And that means that she doesn't have to go through that multiple number of cycles in order to bank enough eggs for her to try for pregnancy in the future. However, if she freezes her eggs too early, say at the age of 20, probably she doesn't have to use her eggs because she might conceive naturally at the age of 28. And also we have to consider the law, the local legislation. The practice of assisted reproduction in Hong Kong is governed by the Code of Practice written by the Council on Human Reproductive Technology. And the Code of Practice clearly states that the maximum storage period for gametes, that is eggs in our case, can only be stored for patients' own use for maximum duration of 10 years. So when we come back to when we should freeze the eggs, if we freeze a woman's egg at the age of 20, she can only use her eggs up to when she is 30. So that is pretty not much helpful. On the other hand, if she freezes the eggs at a later age, say at the age of 40, the eggs are of lower quality and she may not be able to make or generate that many eggs for each cycle. In other words, she may have to go through multiple cycles in order to accumulate the desired number of eggs, and that potentially increases the cost in the whole process. So perhaps the most ideal age for women to consider freezing her eggs is between 33 to 37 years of age. Bear in mind, we have to be careful in women whose ovarian function is compromised for various reasons that I have listed here. For those women, we may want to talk about egg freezing at an earlier age.